Dr. N. K. Venkataramana, founder and director of neurosciences, Brains Super Speciality Hospitals. Among the neuroscientists, consciousness is often used for the wakefulness state. So, consciousness is something, is a bigger phenomenon in which the entire universe functions. Now, as far as the neuroscientists are concerned, we use this consciousness for the patient is awake or not, responding or not, because based on this level we assess the neurological status of the brain, and that is how several scales, for example, Glasgow Coma scale has been established. But in reality, the brain has three states of consciousness. Of that, one is the wakefulness, where a person is awake, is experiencing the surroundings, and the second one is the dream state. The first one is called, in spiritual sciences, is called Jagrata Avastha. The second dream state is Swapna Avastha. Third is the deep sleep, is a Sushumna. Now, in the spiritual state, there is also one more state which is being described, but for all practical purposes, it is the three states in which human being goes through in a day. One is the wakefulness, second one is the dream state, and the third one is the deep sleep. Now, wakefulness is very clear, where the brain is physically active, body is physically active, and mind is also physically active. So, all the three will be very, very active all through. When the daytime passes off and the lights come in, there is a separate mechanism to induce the sleep through the pineal body, and the pineal gland secretes a hormone called melatonin, which influences the onset of the sleep. Now, in the sleep, as far as the neuroscience is concerned, the sleep is divided into two parts. One is called REM sleep, that is rapid eye movement sleep. Other one is NREM sleep, non-rapid eye movement sleep. Now, it is always begins with the non-rapid eye movement sleep. In that, each individual goes through a light sleep, little deeper sleep, and deep rest sleep, and then followed by the again REM sleep. So, it goes in stage 1, stage 2, stage 3, stage 4, and then comes the REM sleep, and again the entire cycle repeats. Normally, in about 7 to 8 hours sleep of an individual, we will have about 2 to 3 cycles of this. REM sleep becomes longer and longer in the early mornings, and non-rapid eye movement sleep, where in the sleep what happens, the mind is active, but the physical body becomes inactive. The body is at rest and mind becomes very active, continues to be active. Brain is also active because it is doing a lot of other functions when the body is resting. Now, in the REM sleep, it is rapid eye movement sleep, is the one is often associated with the dreams. So, in the dream what happens, the brain is active, the mind is active, right, and the body is at rest. Now, the mind tries to project all its past memories and try to create a dream, which is something like a movie. You keep seeing all the activities, and how sometimes the dreams are very good, rememberable, some are very confusing. That is because it depends on the way the brain is daytime, the whole thing is organized. If there is a very organized, structured way of functioning in the day, the similar pattern will be exhibited at night. If not, all the information which is collected and jumbled up has to be assorted at night when your body is taking rest. All this assorted information will be relevant ones are stored, irrelevant ones are discarded, and at the end so much confusing sometimes. Morning when you get up, you may not remember the dreams at all. So, this is a process of clearing up the memory space within the brain, so that again the next day one is fresh to receive the sensory information. So, this is what happens. Whereas, in deep sleep is something where even mind it becomes inactive. So, that is where our scriptures will say that you are getting in touch with the source of yourself. So, that is where you really get in touch with the consciousness and then rejuvenate yourself and reactivate the whole system, so that you come back. Now, we will talk about it a little later about how a deep sleep will connect you to its your own source is a little interesting subject, but we will deal with it little later. But for the time being, sleep has 3 stages, and at the end of the REM sleep, one person again gets up into an awakened state. Now, so in the levels of consciousness, if we look at in the common parlance, here is a awakened state, that is one person is fully awake, active physically. Second one is sleep. Third, the dream state, and in that the deep sleep where all the functions are shut.